multiple point technique, blanching. If you just want to lift the eyebrow and improve the nasofrontal angle, inject deep. And when you inject deep, remember, we have two main very dangerous arteries, so use the cannula. What about the temple? We have in the temple here, it is divided by septi into upper temporal part and lower temporal part. We have here what's called inferior temporal septum from the supraorbital margin till the auricle. So here the upper part will be the upper temporal and lower part, lower temporal area. We have very important structure above and below the inferior temporal septum. The first one and the main one in the upper temporal compartment, we have superficial temporal artery, which is a branch, one of the main branches from the external carotid artery. So this is the anatomy. This is the fat of the temporal area. And as you see, this red line, this is the superficial temporal artery. It is superficial. Its name is superficial. It means the level, without saying it's in superficial level. It means it is in the subcutaneous level. So now how you inject in the temple without damaging superficial temporal artery? Please, just it's very simple. From the peak of the eyebrow, put your index. Just above your index is the course of superficial temporal artery. That's it. If I inject, it is almost 1.5 centimeter just above the peak of the eyebrow. So just below my thumb here, it is in a safe area for injection. Just above, we have superficial temporal artery. So now these are the layers of the temple. So we have in superficial layer, the superficial temporal artery, and we have the facial nerve just above the septum in the upper compartment, where we have to inject in two levels, either superficial and always by cannula, or deep, and this is the most common level of injection. And I think Dr. Muhammad Hussein, when he injects the temple, he will inject at the level of the bone by needle. Why? Because we have up the superficial temporal artery. Now, what will be about the lower part? You talk about the upper temporal compartment, now about the lower temporal compartment. We have very, very dangerous structure. First, as we have superficial temporal artery in superficial compartment, we have a middle and deep temporal arteries in the lower compartments. And we have what is called zygomatico-orbital artery, and it is the largest artery in the temple. It is not superficial artery, it is larger than the superficial temporal artery. So this is the zygomatico-orbital artery. This is the course just from the tragus. It passes in oblique way till the suture here, which is fronto-orbital suture. So this is what is called zygomatico-orbital artery. So now, the second structure is the middle temporal vein, and where this vein will drain in the cavernous sinus. I mean, inside the brain. So now we have a very important structure, which is the middle temporal vein. Where is the landmark of this middle temporal vein? Just above the zygomatic arch, 2 centimeters. This area is safe for injection. This is the zygomatic arch, 2 centimeters is safe, just below my finger. Above is the middle temporal vein. So do not inject above the zygomatic arch by 2 centimeters. Okay, when you put your hand, zygomatic arch, 2 centimeters, in this area is safe. If you inject a little bit higher, you might go inside the middle temporal vein. So now what will be the layers in the lower temporal compartment? These are the layers. I'm not going through, this is more advanced. Just I want to tell you the main structure. Look and see the main structure at a different level. We have the temporal artery. A little bit superficial level, middle temporal artery. zygomatic-orbital artery, middle temporal vein. We have the facial nerve, and more superficial is the superficial temporal artery. I always recommend not to inject by needle in the lower temporal compartment. So what I can do, if I want to do more augmentation of the temple, I just inject very superficial, subdermal level using cannula. Do not please use needles in this area at all. If you want to inject this lower part, inject it by your cannula in the subdermal level. So these are superficial temporal artery with its branches. And we know now that just below we have the middle temporal, deep temporal, the zygomatic-orbital artery. In the upper level, we have the frontal branch of superficial temporal artery. So this is the safe area of injection. Where is the safe area of injection? It is 1 centimeter just above and lateral. And I think Muhammad Hussein will talk about this point of injection. This is more advanced. I will bypass it, okay? At this point of injection, Muhammad Hussein will do. When I go to the cheek, when I'm talking about the cheek, we have the medial cheek and we have the teeth trough area. So simply what will be the main artery we have in danger here? We have the infra-orbital artery, which is branched from the external carotid artery. So first, if you want to inject the teeth trough or the medial part, you must know where will be the infra-orbital artery. It's very simple. So again, we have this line of foramina and medial limbus. Above we have supraorbital. Just below the inferior orbital margin by 1 centimeter, we have the infraorbital foramina. So where will be the infraorbital foramina? Around in the mid-level of the medial limbus, around 1 centimeter just below the infraorbital. Sometimes you can feel it. And in 20% of cases, you will not feel it because it will be not a foramina, it's, we call it, it's just a canal. So how you feel a foramina? There must be a sharp edge, otherwise we never feel it. In 20% of cases, it is not a foramina, it is a form of canal. But mainly in 80% or even more, we can feel it in patients. So just if you put your hand here, sometimes you will feel a notch or a small depression. This is the infraorbital foramina from where it goes up, out the infraorbital artery. So this is the landmark. See, this is the anatomy, infraorbital foramina. We have infraorbital vessels, artery vein, and infraorbital nerve just 1 centimeter below the infraorbital margin. This is the pure anatomy of the infraorbital foramina. This is another picture showing we have here the infraorbital artery, vessels, and nerve from just coming out from the infraorbital area. So now, it is very important to know that the infraorbital artery is not a branch like that. You have 3 branches. We have a palpebral branch, we have a nasal branch, and we have a labial branch. These are the 3 main branches of the infraorbital artery. So where is the main or most danger part is this area 5 and 6. So in this area, which is actually the alar area, we have the 2 main branches, which is labial and the nasal branches of infraorbital artery. So you must put in consideration, we have, when you inject the ala, it's a very dangerous area, and I will say now what will be the level of this artery, so you inject in different level. Now, let's go for the medial part if you want to inject the teeth trough. These are the layer of medial part of the teeth trough. Starting from the skin, orbicular oculi, muscle, palpebral orbital part, till we reach the maxillary bone. So this is the medial part of the teeth trough. What we have, the main structure here, at the mid-pupillar line almost, we have the infraorbital foramina, and we have the angular vein and angular artery at this level. So when you inject, always we say when you inject the teeth trough, inject superficial, small aliquots. Very small. When you inject the teeth trough medially, very small aliquots. and not to reach the bone because we might injure the angular vein.